What's happening at the U.S. Department of Health and Human Services right now isn't just a reorganization, it's a gutting. A full-scale purge. Thousands of careers cut down in a matter of hours. Trusted experts locked out of their own offices. The very infrastructure designed to protect the health and safety of the American public is being dismantled at a shocking pace, and under the thinnest of justifications. It's being called a bloodbath by people inside the agencies, and frankly, that's not an exaggeration. Emails arrived before dawn on Tuesday. Some workers were blindsided, learning they no longer had a job when their ID badges suddenly stopped working. No prior warning, no transition plan, just cold bureaucracy at its most brutal. What began as rumors inside the halls of the FDA, CDC, and NIH is now an undeniable reality. A massive, chaotic wave of layoffs has crashed into our public health system. According to HHS Secretary Robert F. Kennedy Jr., these cuts, totaling over 20,000 employees, are part of a new plan to do more with less, to eliminate what he calls bureaucratic sprawl. But what's really happening is that we are tearing down the very agencies we rely on to safeguard public health, in the name of efficiency. But efficiency isn't what this looks like. This looks like destruction. Entire departments are gone. The Office of Minority Health shut down. The Office of Civil Rights gone. The entire press office at the FDA dismantled. Hundreds of public health scientists, experts in HIV prevention, maternal care, workplace safety, environmental health, and even child protection, all laid off or reassigned. Many are being forced to relocate across the country, to places where they have no personal or professional connections, as a thinly veiled way of pushing them out. At the CDC, programs focusing on smoking prevention, reproductive health, and chronic disease were gutted, even though Kennedy claims chronic illness is the agency's new focus. There's no logic here, just cuts. Dr. Robert Califf, former head of the FDA, didn't mince words. The FDA, as we've known it, is finished. He warned that product safety is now at risk. Without the institutional knowledge of seasoned professionals, the very drugs, medical devices, and treatments Americans rely on could become compromised. If we don't do a good job reviewing, he said, we're going to unleash some things that are really dangerous into the population. This isn't fear-mongering. This is a credible warning from one of the top experts in public health. And it comes as the private sector is already feeling the ripple effects: hiring freezes, rising healthcare costs, and potential delays in approvals for life-saving medications. Meanwhile, confusion reigns inside the agencies. Supervisors don't even know which of their team members are staying or leaving. Some staffers received severance letters citing poor performance scores that were incorrectly recorded or possibly manipulated. These errors are reducing severance payouts and forcing people to make legal decisions under duress, not knowing if the documents they're being pressured to sign are even accurate. It's not just policy experts and administrators who are gone. It's frontline responders, public servants who handle disease surveillance, emergency response, child welfare, and programs for low-income families. The staff of LIHEAP, the agency that helps millions of Americans pay their heating bills, was completely terminated. That program, which distributes billions in aid each year, now risks total collapse. How do you get emergency heating aid to vulnerable seniors without anyone left to run the program? And for those trying to raise concerns, there's now no one to talk to. When employees who were fired from the CMS Civil Rights Office tried to file a complaint, the instructions told them to contact a director who had been dead for 4 months. That isn't just disorganization. That's gross negligence. It's humiliating. It's dehumanizing. And it's emblematic of how this entire process has been handled. This is not how a government treats its workers or its people. Despite Kennedy's promises of radical transparency, there has been zero clarity on how these cuts were chosen, how they'll affect essential services, or what, if any, plan exists for maintaining operations with such a drastically reduced staff. Congress is demanding answers. Senators across the aisle, including Bernie Sanders and Bill Cassidy, are pushing for hearings. But the damage is already done. Health experts are now warning of the long-term effects: slower drug approvals, weaker safety standards, reduced disease monitoring, and a crippled emergency response infrastructure. And this is happening in a country still recovering from the scars of the COVID-19 pandemic, a country that knows firsthand the cost of not being prepared. These cuts are not just irresponsible, they are dangerous. Kennedy's claim that the agency is shifting toward prevention sounds noble until you look at the facts. The very teams responsible for monitoring diabetes, nutrition, maternal health, and rural care have been fired or reassigned. Even the Freedom of Information officers, the ones who handled transparency requests from the media and public, have been eliminated or sidelined. This isn't prevention. This is erasure. What's truly chilling is the precedent this sets. If this kind of dismantling of critical government institutions can happen this quickly, with this little oversight, what else can be taken apart? The people who have lost their jobs aren't just numbers. They are scientists, analysts, civil rights advocates, program directors, social workers, people who devoted their lives to public service. Many have mortgages, families, and nowhere to turn. There is no soft landing here. Only silence and locked doors. Let's be very clear. What's unfolding right now is not just a bureaucratic reshuffling. It's a warning. If we allow the country's public health infrastructure to be decimated without consequence, we are not just firing workers. We are firing our future safety, our preparedness, and our ability to respond to crisis. The bloodbath is real. And if it continues unchecked, it won't just be federal workers who pay the price. It will be all of us.